Hi, and welcome to the UC Berkeley webinar for the mandatory tuberculosis and immunization requirements for incoming students. First of all, congratulations on your acceptance to UC Berkeley. We're very excited to have you. And for this webinar, we're going to go through how to meet the TB and immunization requirements for incoming students. As you may have seen some emails and other information about these requirements. So let's get started. So all incoming and readmitted students must satisfy TB clearance and immunization requirements prior to the start of their first semester here at UC Berkeley. You can learn more about these requirements at uhs.berkeley.edu/requirements, and we'll demo that website as well later on in the presentation. So a question we often get is, why does UC Berkeley have these requirements? These requirements are mandated by the University of California Office of the President, or UCOP, and their immunization policy. And the goal is to protect you, your classmates, and the entire UC Berkeley campus community from vaccine-preventable communicable illnesses, as there have been outbreaks throughout the country over the last 2 years. And given that our students are often in close quarters here on campus, in classes or living together in dorms, et cetera, we've worked with the California Department of Public Health and CDC guidelines to establish vaccine standards that will minimize the risk of outbreaks of infectious diseases in the campus community. So what are these requirements? The first is TB screening, which may or may not include testing as well, depending on your specific medical history. There are 4 required immunizations: MMR, which is measles, mumps, and rubella; pertussis or Tdap; varicella, and the meningococcal conjugate; and seasonal immunizations for all students, not just incoming students. These will be coming up in fall 2025, and those will be the COVID-19 and influenza vaccines for the 2025 to 2026 season. We'll go over all of these requirements in further detail later on in the presentation. As we said, you can visit our website for more information, uhs.berkeley.edu/requirements. So this is our website, and some helpful pages on here are the frequently asked questions, which is a really great resource. It answers some of our most common questions. It also includes links to, if you'd like a template for your doctor to fill out, for example, for your immunizations, you can do that. It's not required, but there are some great resources and information on our website. It also goes into detail about each of the requirements. So let's say you want to learn more about the meningococcal conjugate requirement. You can go and read more information about that. Another really great page is the Finding Your Records page. This has some really great resources for how to find your immunization records from your primary care provider, family, prior schools. It also includes a link to the California Immunization Registry if you were vaccinated in California, as well as a link to the CDC list of other states' immunization systems if you were vaccinated in a different state and need help getting your records. Okay. Okay, so some more information about the due dates for these requirements. The formal due date for incoming fall 2025 students is July 31st, 2025. There is a 1-month grace period before any consequences for non-compliance go into effect. If you're still not compliant by September 1st, you may be charged a $50 late fee. And then if you're still not compliant, if you're still not compliant by October 1st is when you would get an enrollment hold, which means you'd be unable to register for spring 2026 until the requirements have been met. Your fall 2025 courses and enrollment would not be affected, but you would not be able to register for subsequent semesters. And so we really do recommend that you start the process early, especially as some of these vaccines require multiple doses that may need to be spaced out. So give yourself some time to get everything taken care of so you can have an easy start to the semester here. Okay, so using the eTang portal. The eTang portal is our patient portal for health records. Depending on when you're watching this video, you may have seen some information about MyChart or My UC Berkeley Health. We are in the process of switching to that system. However, for fall 2025, the TB and immunization requirements will still be processed through the eTang portal. You can log in at eTang.berkeley.edu. You'll use your CalNet ID and credentials to log in, so the same way you log into CalNet. Please do note that if you just notified the campus that you're accepting your admission, it may take up to 1 week for the eTang portal to populate your account. If it's been less than a week, please give it some time if you're getting an error message. If it's been more than a week, please do reach out to us for assistance. So just to show you what that eTang portal looks like, we're logged in here for a test patient. This is the homepage that you'll see. Before we get to the immunization requirements, one of the first things you're going to want to do is go to the medical clearances page, accessible here on the left or right here, and actually scroll down to additional items not required for clearance. In this case, you're going to want to submit these last two forms, the notice of privacy practice and the statement of financial responsibility, in order to have full access to everything on the portal, including, for example, sending us messages through the portal if you need to do so. So do make sure to do these two, the notice of privacy practice and the statement of financial responsibility. Speaking of messages, if you do need to reach out to us, there is a messages feature through the eTang portal. You can go to messages, new message. This is a test patient, so you can ignore those. And then there is a contact the TB immunization team option. You'll hit continue, and then you can send us any questions, and it'll be attached to the information in your chart. So back to the medical clearances page. How to get started on submitting your requirements. So the TB clearance requirement, the first step for that is these TB screening questions that you'll see right here. It's just 5 yes or no questions that you need to submit. Please do make sure to read the questions carefully and double check your responses before you hit save. We do occasionally audit the responses, so please make sure they're accurate. And make sure to read everything on the page and all the instructions before you hit submit. Once you've submitted the questionnaire, the system will let you know if we need additional information, such as a TB test or a form that your doctor may need to fill out. In that case, you will see additional items, appear here. You would see an additional item that says, for example, TB test results or TB medical clearance form. And you'll receive a message. Again, messages can be read here at midnight that same night with instructions if there are any additional steps you need to take. So once you've submitted the TB screening questions, the system will immediately alert you if there are additional steps that need to be taken. Okay. For the immunizations, you'll need to enter your vaccine information and upload your records. Any self-reported information that you enter, so vaccination dates or test results, do need to match your uploaded documents. We can only accept self-reported dates or results that are supported by your uploaded records. So the way you'll enter that information is by clicking update on the line for each requirement. So for example, here for measles, we'll click update and we'll get this pop-up window. The help text does explain the specific requirements for that item. So make sure to read that. That usually also includes a link to our webpage for that specific item if you have questions. Please note that by entering this information, you are attesting that it's correct to the best of your knowledge. And please note that if you do knowingly falsify anything, you may face disciplinary action. So again, please don't enter any information that's not on your uploaded records or that doesn't match. Some other notes, some vaccines require 2 doses. Again, you can read that information here at the help text. In that case, you'll need to add 1 immunization, put the date here, let's say, let's just say This person was vaccinated. And then you'll select the immunization. You'll hit save, and then you'll do so again for the second dose. You're not able to enter both at once, but you can enter them separately. Delete that. You'll also see this test results section. So this is, you're not required to enter test results. This is an option for people who have, for example, received the vaccines but no longer have records, or for example, for varicella or chickenpox, if you had chickenpox and never received the vaccine, again, you can get this titer or blood test. It is not required to enter 2 doses of the vaccine and the titer. Another quick note is the meningococcal is only required for students under the age of 22. So if you're over 22, you won't see that on your medical clearances page, and that's fine. So that's how you enter all of your dates. You'll also see this immunization record line. That's where you'll upload your record. So you click update. You can submit multiple documents if you need to. You'll just have to do it one at a time. Please make sure that the file is less than 4 megabytes and that the file name is short and doesn't contain any special characters. That is the most common cause of upload issues that we come across. Once you've done that, you'll hit save. The system will immediately update once you enter your information to show your compliance status. So if you've entered it and it still says not compliant, that means that something is missing. While eTang does update immediately, please note that it will take Cal Central several days to update once eTang has updated. But please rest assured that we use eTang for things like the late fees and enrollment holds. So you don't need to be too concerned if it takes a couple of days for Cal Central to update. Okay. Just some helpful tips. Do go ahead and submit all records that you have before the due date, even if you're still waiting to complete one or more of the vaccine series. And we know that some of these required vaccines aren't always available in other countries, or you may have difficulty accessing an appointment before you arrive. So we are here to help you complete those requirements once you're here on campus. While we do recommend that you complete everything before you arrive for the best possible public health protection for you and all other students, if you're unable to do so, you can get the remaining vaccines and or testing performed here at the Tang Center once you arrive on campus. If that is the case, please make sure to schedule your appointments as soon as possible once you arrive. And please note that for incoming fall 2025 students, your eligibility to be seen here at the Tang Center for Services begins on August 1st. So you would have to wait until August 1st in order to be eligible to get the vaccines or any testing here. Okay, so let's go into some more detail about the requirements for each of these vaccines. So for MMR, which is measles, mumps, and rubella, the requirement is 2 doses on or after the first birthday, with the doses being given at least 28 days apart. This can be given as a combo MMR vaccine or as measles, mumps, and or rubella vaccines separately. In any case, you would still need 2 doses of each. And there is a titer option for this vaccine. So if you've received both doses of the vaccines but don't have records, you can get a titer or blood test to check for immunity. We can accept results showing that you have immunity for measles and mumps and rubella. But please note that if the titer shows that you do not have immunity, you do still need to provide records of both doses of the vaccine in order to meet the requirements. Okay, varicella or chickenpox. The requirement for this is also 2 doses on or after the first birthday, the doses being given at least 28 days apart. There is also a titer option for varicella. So again, if you receive both doses but don't have records, or if you had chickenpox as a child and didn't receive the vaccine, you can get the blood test. Again, if the blood test shows that you are immune, that would meet the requirements. If you're not immune, you would need to provide record of both doses. Not everyone who has chickenpox or shingles necessarily develops immunity, so the blood test is necessary to prove immunity. We cannot accept a doctor's note stating that you had chickenpox. That is not sufficient for the requirements. Just one note, MMR and varicella vaccines must be administered either on the same day as each other or at least 28 days apart. So for example, if you have an MMR vaccine today, you would need to either get varicella vaccine today or wait 28 days in order for it to be valid. Okay, so pertussis or Tdap. The requirement for this is 1 dose of Tdap on or after the 11th birthday and 1 dose within the past 10 years, which for fall 2025 students is calculated as August 1st, 2015 or later. The dose within the past 10 years, we can accept a TD dose for that portion of the requirement, but you do still need a record of a dose of Tdap on or after the 11th birthday. If you received a dose of Tdap on or after your 10th birthday and within the past 10 years, we can accept that per CDC guidance. Just a note, the Tdap requirement, the pertussis is the P in Tdap, that is required. So just a tetanus shot or TD dose or a childhood DTaP series in infancy or before the age of 10 or 11 is not sufficient. And the meningococcal conjugate, or MenACWY, the requirement for this is 1 dose on or after the 16th birthday. Again, this requirement only applies to students under 22 years of age. MenB does not fulfill this requirement. That only protects against the B strain of meningitis, and we're looking for the ACWY version of the vaccine. Sometimes it's listed by brand name on your records, which would include Menveo, Menactra, Menquadfi, or Penbria. Any of those would meet the MenACWY requirement. So the tuberculosis or TB clearance, the first step is to submit those TB screening questions on eTang. Once you've submitted those, additional testing or forms may be needed, in which case that testing could include a skin test, also called a PPD or Mantoux, or a blood test, also known as an IGRA, or by brand names quantiferon or T-spot. Please note that if you've had the BCG vaccine, we do strongly prefer the blood test over the skin test in that case. And again, if you are asked to provide TB testing, it needs to be from within 1 year of your first enrollment date, which for fall 2025 students is considered August 1st, 2025. So the TB test needs to be from August 1st, 2024 or later. And then documentation. So all documentation, whether that's vaccine records or test results, all of those do need to be in English or translated into English. But we do have templates available on our website if you'd like a form to just hand your doctor and have them fill out. Those forms are not required. Your doctor can provide them, those records in their own format, as long as, again, they're in English, and they include your name, date of birth, and all the relevant medical information, and were prepared by a licensed medical provider. There are more details available on what exactly qualifies as an acceptable record on our website. Okay. So there are also COVID-19 and influenza vaccine requirements. You'll notice that we've separated these. So that's because these are both seasonal vaccines, which are required for all students and staff, not just incoming students. The requirement is 1 dose of the most recent version of the vaccine, so the version for the current season. Right now, at time of filming, it's March 2025. So right now, the 2024-2025 version is available. The 2025-2026 version of the COVID vaccine and influenza vaccine is what is going to be required beginning this fall, which usually is released around August or September. So it's not yet available at this time. The due date for this requirement is usually separate from our other TB and immunization requirements. It is likely to be November 1st, as that's what it has been in previous years, but that is subject to change. But we will send out communications and emails with updates if anything changes. And these requirements do not incur a late fee or enrollment hold for noncompliance, unlike the other immunization requirements. And these requirements can be met via a declination on the medical clearances page. You can decline them for any reason. However, we do strongly recommend vaccination due to the high prevalence of illness that we've seen this past season. Okay. So just to go over some frequently asked questions, how can I find my records? So you can ask family for your early childhood vaccine records. You can check with your primary care provider, prior schools if you had to submit vaccine records to them, or your state registry. You can see the Finding Your Records page on our website for some more guidance and links to resources. My medical records are not in English. What do I do? So you can have your records translated into English, or you can have your doctor fill out the immunization form that's available for download on our website, and use that to upload to eTang for your record. I get an error message when I try to upload my documents on eTang. What should I do? So the first step, please make sure the file is less than 4 megabytes. If not, you will need to compress it. And make sure that the file name is short, so fewer than 100 characters, and that it does not contain any special characters. You are able to upload multiple files. You just need to do so one at a time. Okay. I turn 22 next month. Do I still need the meningococcal conjugate vaccine? So if you turn 22 before the July 31st due date, you do not need to meet the requirement and it will disappear once you turn 22. However, the vaccine may still be recommended for you. Please consult with your doctor or primary care provider. But it is not a requirement if you turn 22 before the due date. I've had the BCG vaccine, so can I be exempt from TB testing? The short answer is no. The BCG vaccine does not provide lifelong protection against tuberculosis and is not known to be effective against adult pulmonary TB, the most infectious kind of TB disease. So screening and testing are still necessary. You'll start by submitting the TB screening questions on eTang. If you're then required to submit TB testing, again, please note that we recommend the blood test, not the skin test for people who have had the BCG vaccine. What if I have a medical or religious exemption? So medical and religious exemption requests are available through the downloadable forms page on your eTang portal. Please note that the review of those forms can take several business days, so make sure to submit the forms early if needed. And the seasonal COVID and flu vaccines can be declined for any reason by you. You don't need to submit a form for those. I entered my vaccine information. Why does it still say I'm non-compliant? Please make sure that the doses you entered and have meet the age and timing guidelines, which are available on our website or in the help text and pop-up window when you enter your dates on eTang. If your doses do meet those requirements and your compliance status still isn't updating, please reach out to us for assistance. So just to review some important dates, the due date for the TB and immunization requirements, excepting COVID and influenza, for incoming fall students is July 31st, 2025. Late fees for noncompliance will be placed on September 1st, and enrollment holds for noncompliance will be placed on October 1st. Again, that affects your spring 2026 enrollment, not your fall 2025 courses. The COVID and influenza vaccine requirement will likely be due November 1st. Again, that is subject to change, but we will send out campus communications with that information closer to the fall. And there are no late fees or enrollment holds for noncompliance with the seasonal COVID and influenza requirements. So we know this is a lot of information and it can be really overwhelming. So we're here to help you. If you would like to contact us, you can send us a message through the eTang portal, as we showed. Um, it's one of the best ways to reach us because it is attached to your chart, so we're able to review your records and give you detailed information specific to your medical history because it's a secure method of communication. Other ways to reach out to us are to email tbimmune@berkeley.edu. Please do not send medical records via email as it's not secure. You can also call us at 510-664-5090 or visit us in person on the second floor of the Tang Center at 2222 Bancroft Way. Our phone and in-person hours are Monday through Friday, 8 a.m. to 12 p.m. and 1 p.m. to 4:45 p.m. We are closed on holidays. But our website is always open. You can check uhs.berkeley.edu/requirements for answers to frequently asked questions, links to forms that you may need, and information about resources. So again, we're here to help you. We usually respond within 1 business day to any outreach, but please note that that turnaround time may be longer during our busy periods, which are usually right near the due date or the date that holds go into place. So it is best to reach out early with any questions if you have them. That's it. We are excited to have you coming to Berkeley, and we hope to hear from you soon. Go Bears.